The internet and social media has been instrumental for many in opening a door to bariatric surgery. This has undoubtedly broken down barriers to accessing information for many. You can now follow the lives of those who have undergone surgery and really understand the lived experience of what this may look like for you. Whilst this can be helpful in making decisions about whether to pursue weight loss surgery and which procedure may be best suited to you, the sheer amount of information available and understanding how accurate and relevant it is to you can sometimes be overwhelming and confusing. So how do you make sense of it all? Well, my advice would be to try and adopt a balanced approach. It's important to undertake your own research on the topic initially to understand whether bariatric surgery is something you wish to consider. However, it's also important that you speak to experienced healthcare professionals who work within the field and have a broader as well as a more nuanced understanding of how the different options may impact on you and your own set of circumstances. It is vital to understand that there will never be a single choice available to you that offers only positives with no downsides. Every option, including the option of doing nothing, has a trade-off, and this needs to be carefully considered. Sometimes your set of circumstances may mean that you have to choose the least bad option to help achieve significant weight loss. For example, our current understanding is that the sleeve gastrectomy can be linked to worsening heartburn symptoms, so if you already have significant acid reflux or heartburn, your consultation may focus on the benefits of the gastric bypass in that scenario. However, this needs to be balanced against the greater risk of longer-term nutritional problems and other issues related to the bypass, which is a more invasive procedure. This is particularly important in the younger patient group, where extra thought needs to be placed with respect to the longer-term impacts and effects of surgery on health and well-being. Our understanding of obesity has changed significantly over the last decade or so. We now recognise that obesity is a chronic and relapsing condition that requires long-term control. Often, patients may initially be drawn towards non-surgical options such as a gastric balloon or injectable medications or a gastric band because these treatments are reversible and temporary. However, many patients will change their mind once they understand that long-term tools are required to manage long-term problems. When considering which options to pursue, also keep in mind your own goals and aspirations. What is it that you want to achieve the most? For example, do you want to get your BMI down into the 20s? Or is it that your focus is more towards improving certain health conditions? If you want to maximize weight loss, it may be that you opt to go for a more invasive option such as a gastric sleeve or bypass, or even that you opt for a combination of multiple treatments. Another consideration is that whilst a bypass may be better at achieving slightly greater weight loss than the sleeve in the short term, we also need to be mindful that there are currently very few effective strategies to address weight regain after a gastric bypass if it occurs. However, if weight regain occurs in the future in the context of a gastric sleeve, there are further surgical options, including a gastric bypass. These pragmatic considerations should be explored, particularly in younger patients, and may impact on decision making. Ultimately, these points and other considerations need to be discussed with your surgeon. Once again, this highlights the importance of ensuring that your bariatric team is experienced and can offer a range of options to suit your needs.